Assalamu alaikum wa rahmatullah wa barakatuh. I hope everyone is doing well. So today our subject is about safe medication in pregnancy, series 5. We will speak about antibacterial, antiviral, and antiprotozoal medication which are safe in pregnancy. So these are the contents which we will speak today in our lecture. Just from this chart, we can see which medication that can be used safe in pregnancy in first and second and third trimester. As you see here, that we can use azithromycin, azithromycin, penicillin, cephalosporin, clindamycin, in addition to the flagyl, metronidazole, which are safe in all trimester of pregnancy, while the red one is contraindicated, like quinolone, which are lead to cartilage damage in animal, tetracycline, tooth and bone defects. Clarithromycin cannot be used because there is a birth defect in animal. Doxycycline is also contraindicated. Nitrofurantoin can be used in only second because in the first might lead to some congenital abnormality. In third, can lead also to some problem in the baby. The methibrim is the same, can be used only in second trimester. So, if we have one patient complain of acute otitis media by examination, and you found that the tympanic membrane is red, and all your examination reached that she has otitis media. So the first line of management is amoxicillin 500 milligram TID. Second choice is augmentin. There are several questions about augmentin that cannot be used in pregnancy, but according to the update, as per RCOG and Canadian guidelines, can be used is only if there's risk of preterm labor, because the preterm baby, if the mother taking augmentin, can lead to some problem in the intestine. However, the study found that amoxicillin and augmentin is safe in all trimester of pregnancy. What about acute sinusitis? The same. Amoxicillin and augmentin can be used in all trimester of pregnancy. Pharyngitis. For pharyngitis, we must know whether it is viral or it is bacterial. We will use a specific center score for clinical assessment of pharyngitis. So, if we have fever, we give 1 point. No cough, 1 point. Tender anterior cervical lymph adenitis, 1 point. Tonsillar oxidate, 1 point. So, if the center score is 0 to 1, this is unlikely to be bacterial, so only give symptomatic treatment. While if it is 3 and above, so this is suggestive of Streptococcus pyogenes and better to give antibiotic. The antibiotic can be used in case if the center score 3 to 4 is amoxicillin or phenoxymethylpenicillin or civalexin, Keflex, or clarithromycin. But the clarithromycin, as we mentioned in the previous slide, it's better to be avoided. So here we have only amoxicillin or phenoxymethylpenicillin or civalexin. And as you know that group Streptococcus pyogenes is susceptible more to penicillin. So it's better to use amoxicillin, TID, or 5 to 10 days, depend on the local prevalence or previous history of rheumatic fever. What about dental problem? Many patients, they have toothache, and some patients need antibiotic. The same, we can give amoxicillin, 500 TID, or phenoxymethylpenicillin. The same, 500 or 800,000 every 6 hours orally. And sometimes we give only for 3 days if it is adequate source control achieved, or if need not achieved, the adequate source need 5 days. So in the dental problem, we can give amoxicillin, which is safe. What about mild skin or soft tissue infection? The same, we can use augmentin or civalixin or cloxacillin, because they found that cloxacillin and civalixin has a narrower spectrum of antibacterial activity compared to augmentin and have a good efficacy. In these two antibiotics are the preferred option whenever possible. So if we have civalixin, which is Kiplex, we can give 500 TID oral, or cloxacillin 500 every 6 hours, or 2 grams every 6 hour IV. But because we are in primary health care, we can give cloxacillin 500 every 6 hours, or civalixin 500 every 8 hours, or augmentin. But they found that for skin and soft tissue, the best is to use civalixin and cloxacillin. Now we will come to the important and the common cases that many pregnant women, they have toothache. So, many pregnant women, they have like toothache, maybe due to calcium deficiency. So also we prescribe calcium, which is safe in pregnancy. And the safe antibiotic is amoxicillin, clindamycin, civalixin, flagyl, erythromycin. Depend on which medication the dentist want to give. Sometimes the dentist gives amoxicillin and flagyl, metronidazole, to cover aerobic and anaerobic. And what are the safe dental procedures? Many pregnant women came to us in Obsingani. They asked whether it is safe to do root canal extraction or X-ray. So here, the advice to any woman is better to do safe dental procedure or regular checkup. Scaling is safe. Filling is safe. Root canal extraction is the best to be done in the second trimester. Dental X-ray with shielding, second trimester is best. However, they found that the X-ray has small radiation, so has no issue on the baby in first trimester. Emergency procedure can be done anytime. So if the patient, for example, tooth extraction, but it is like not severe pain, we prefer to do it in second trimester. However, if she came in third trimester, we will give her fitness for tooth extraction. What about medication safety? As we say that paracetamol is the first choice for pain relief. Lidocaine with epinephrine also is safe. What about preventive advice? We would advise the women for good oral hygiene, avoid sugary food, and rinse after vomiting. So for gingivitis, sometimes the woman has gingivitis. This is due to hormonal changes. Just we'll advise her for hygiene, also for increased vitamin C. What about periodontitis? Sometimes linked with preterm birth risk. Sometimes dental caries, toothache, abscess, erosion. These cases can be managed easily and safely during pregnancy. As we say, for gingivitis, we'll advise the women for good oral hygiene and vitamin C. Periodontitis, we can give, for example, antibiotic. And we say that antibiotics are amoxicillin, clindamycin, civalixin, flagyl, erythromycin. And dental caries can do filling, no problem. Toothache and abscess, sometimes it need antibiotic or any surgery intervention. Vitamin test is not contraindicated. But in general advice, we advise for good oral hygiene, as we say, and regular routine dental visit, especially in the second trimester, because if she has any issue in her tooth, can be fixed easily in second trimester. About the imaging, we say it is safe using X-ray. And again, just to repeat that, scaling, filling, root canal extraction are all safe in second trimester. but emergency can be done any trimester, not necessarily same trimester. And we say that also for the second trimester is the preferred for elective procedure. However, if need any intervention in third trimester, it is just will advise the women to be reduce the time in supine position until the patient slightly to the left side. Anesthesia, we say it is safe, analgesia, it is safe. For non-steroidal anti-inflammatory drug, it's better to be avoided in third trimester. And we mentioned about the antibiotic. What about the eye problem? If there's any bacterial eye infection, ceftriaxone 250 for gonococcal conjunctivitis can be used, mixed with azithromycin. For bacterial keratitis, we can give aflatoxin 0.3% eye drop, 1 drop in affected eye every 1 hour for 48 hours, then every 4 hours until healed. The drops are preferred over ointment because they have better corneal penetration. Even though aflatoxin considered as catechoic, but still can be used in small amounts as minimal systemic absorption. Regarding erythromycin, tobramycin are often preferred as safe alternative. What about asymptomatic bacteriuria? Asymptomatic bacteriuria is that all women should be screened for asymptomatic bacteriuria with urine culture. So the best diagnosis for bacteriuria is urine culture and to be done at 12 to 16 weeks of gestation at first antenatal visit. How we diagnose asymptomatic bacteriuria is that the urine culture with bacterial growth more than 100,000 cells per milliliter without any symptom of UTI. That's what called asymptomatic bacteriuria. And if we find that there is bacterial crowd in the urine culture, so it's better to give the antibiotic according to the bacterial crowd, because this can lead to complication like preterm labor, septicemia, or other complication to the pregnant women. Okay, so what about urine dipstick test for any bacteria or nitrates should not be used. Midstream urine should be sent for culture and sensitivity. And a fellow urine culture, of course, after antibiotic to be repeated. Because sometimes there's persistent asymptomatic bacteriuria or sometimes recurrent. Persistent, that means the urine culture is positive with the same organism. And sometimes recurrent, that's another organism that lead to asymptomatic bacteriuria. But as we all know, the most common bacterial that lead to UTI is E. coli. So the management, again, is amoxicillin we can give, or we can give nitrofurantoin every 6 hours, but better, as we say in the first slide, to avoid in third trimester because of risk that the baby might have G6PD deficiency, or trimethoprim also to be avoided in first trimester and the last trimester. So it's to be on the safe side, we can give amoxicillin or augmentin, or we can give cefixime 500 PID for 5 days. And sometimes if there's recurrent bacteriuria or recurrent UTI, we can give like another course of antimicrobial based on culture and sensitivity. Antimicrobial prophylaxis is not recommended. Again, this is just how to diagnose asymptomatic bacteriuria. As we say, always we'll ask the patient to give a clean cash midstream urine. The test is urine culture. The diagnosis was more than 100,000. And confirmation may repeat culture before initiating treatment. Dipstick is not diagnosis, as we say, and the most common pathogen is E. coli. And Sometimes midstream urine may show pyuria, white blood cell, or bacteria, or positive nitrate, or leukocyte straight. Midstream urine is a screening tool? No, it's not a diagnosis, but the diagnosis is only by using urine culture. This is the important point of diagnosis of asymptomatic bacteriuria. What about cystitis? Sometimes many patients complain of dysuria, frequency, urgency, sometimes fever. So he will do urine dipstick, and we will find if there's any bacteria or nitrate. We can give antibiotic if she is symptomatic. And these are the antibiotic that can be used according to Ministry of Health of Oman antenatal guideline. We can give amoxicillin 500 TID for 5 to 7 days, possible to be continued 15 days, or cibalexin 500 QID 5 to 7 days, or augmentin TID, or we can use the nitrofurantoin 100 milligram BID for 5-7 days, but their trimester to be avoided because G6PD is unknown. Also, according to Ministry of Health of Oman, they say that daily antibiotics should be considered in pregnant women after one episode of pyelonephritis. Regime for daily prophylaxis includes cibalexin 200, 500 nightly, or nitrofurantoin 100 milligram nightly. That means if the patient has recurrent UTI and or one episode of pyelonephritis, there's some what's called prophylaxis is to give cibalexin 1 capsule daily at night till delivery, or nitrofurantoin 100 milligram every night, but it's better to give cibalexin. This is according to Ministry of Health of Oman guideline. What about community-acquired pneumonia? You must diagnose it depending on the clinical finding, investigation, and examination. And if you diagnose as pneumonia, you can give simply amoxicillin plus azithromycin. And here the amoxicillin can be given 1 gram every 8 hours, or azithromycin 500 OD. And sometimes there's some study, they say better to give 500 oral 1 tablet than 200 daily for 4 days. Regarding the viral infection for influenza, we can give oseltamivir 750 twice daily for 5 days. For chickenpox, we can give acyclovir 800 milligram 5 times a day for 7 days. Herpes simplex is 400 3 times 5 days. So just acyclovir is safe in a pregnancy, and chickenpox can be given 800 5 times per day for 7 days, while in herpes simplex 400 milligram 3 times a day for 5 days. And here some found what is the difference between zanamivir and Tamiflu. We say that Tamiflu is safe in pregnancy. Zanamivir is not available in pregnancy, not available in primary healthcare. Regarding the common fungal antiprotozoal disease, as we mentioned previously regarding the candidiasis, we can give clotrimazole 500 milligram vaginal suppositories single dose, or meconazole vaginal cream for 7 days, or nystatin suppositories, if not albicans, Candidian albicans. And of course, we can give also steroid skin cream to reduce the itching. Bacterial vaginosis, we can give clindamycin vaginal cream, which is available in all primary healthcare. Trichomonas vaginalis, we can give also flagyl 500 milligram BID for 7 days. Regarding the syphilis, we can give benzodiazepine, And this is, the diagnosis is by VDRL. Regarding the gonococcal infection, we can give ceftriaxone 1 gram intramuscular as single dose or cefixime 800 orally with azithromycin. Chlamydia, we can give azithromycin single dose or erythromycin 500 QID 7 day. Regarding the malaria, as we know, malaria is very uncommon, but if we get one patient with malaria and diagnosed by thick and thin blood film, we can give quinine or gentamicin. If severe malaria, we can give artesunate, this is of course in secondary, not primary healthcare. Antihelminthing is very important because also some cases coming to us, pregnant women with the worm. So here it is according to a Canadian guideline, they found albendazole is the recommended drug of choice for deworming of pinworm. But deworming should be done after the first trimester of the pregnancy, preferably in the second trimester. And the dose is single dose of 400 milligram albendazole is recommended. So, what are the antihelmintic used in first trimester? It's all are avoided. Only what's called parental formoid, which is not available. So we have only albendazole, but they found that albendazole is better to be avoided in pregnancy, and if need is better to be deferred and postponed till the second trimester. And will advise for strict hygiene, hand washing, short nails daily, morning shower, change underwear, bed linen, daily clean household surface to prevent reinfection. If symptoms are severe, we can use parental pomade, but unfortunately it's not available in primary health care. So again, avoid albendazole in first trimester as much as possible, but can be used in second and third trimester, and the dose is single dose only. What about antituberculosis? We can say isoniazid 300 milligram once daily, rifampicin 600 milligram once daily for 6 months, with pyridoxine 10 milligram daily to reduce risk of isoniazid-induced neuropathy. Pyridoxine is safe, everyone knows. Regarding isoniazid and rifampicin can be used, and the isoniazid is the safest in pregnancy among other antituberculous medication. Rifampicin, some theoretical risk of teratogenesis can happen, but sometimes if we need to use it, we can use it according to the condition. And these are the chart of what are the medications that can be used. They say if pyrazinamide 1.5 to 2 gram daily can be added to the first 2 months in those cases where resistance to other first-line drugs is suspected or documented. So the first line is isoniazid and rifampicin. And again, these are the medication that's available in primary healthcare. And its categories, as you see here, venoxymethylpenicillin is safe, amoxicillin is safe, fluoxacillin is safe, civalixin is safe, ciproxime is available 250, and we can use it for UTI as 500 milligram BID. Erythromycin is safe, clarithromycin better to be avoided. Cotrimazole, first trimester and third trimester better to be avoided. Doxycycline is not to be used. Ciprofloxacin better to be avoided. Isoniazid, we say we can use it. Rifampicin is group C, is better to be avoided as much as possible. Flagyl can be used in all trimester. Chloroquine can be used even though it's fee-free because there is the low study about it. As you know, malaria is not common, but can be used for malaria vivax type. And chloroquine, again, we mentioned HC. Acyclovir can be used. And also, oseltamivir is safe. Amantadine is safe. Nystatin safe. Fluconazole is contraindicated in pregnancy. Albendazole is better to avoid in first trimester, can be used in second and third trimester. And these are the references that I used in this lecture. Thank you very much for your listening.